We are glad that today we are being joined by amazing panelists from Kenya, the Gambia, and USA. And our representative from USA is also representing the Asia Network, but we'll get to hear more about them. Our moderator today is our Global Advocacy Director, Leila Hussein. And she's very passionate about the work of working with survivors, but also around reframing the narrative. I also want to say that this webinar is being recorded and interpreted in French and Amharic and also sign language. For those joining us just now, if you want to listen in French, please select at the globe sign on your gadget. You can go to French, and also for Amharic, we ask that you select Amharic. As we continue to allow others to join in, allow me to share very briefly about this program. The Girl Generation Support to the Africa-led movement is being implemented by a consortium led by Options Consultancy Services, and also includes AMREF Health Africa, ActionAid, ORCID Project, the Africa Coordination Center for the Abandonment of FGM, and the University of Portsmouth. We also work very closely with Population Council, Data Hub, who are the program's data and measurement arm for this program. Our vision is a world where girls and women can exercise their power and rights, have expanded choice and agency, and be free from all forms of violence, including FGM. Our program is underpinned on the do no harm and ethical principle, ensuring that survivors, champions, and communities we work in are safeguarded. I want to highlight that conversations around FGM can be very triggering for some individuals, especially survivors, and therefore we urge all participants to engage with care, respect, and empathy. If at any point you feel overwhelmed or distressed, please feel free to step aside, and because we want to prioritize your well-being. Feel free to chat on the chat box like you're doing right now. You can share your comments and your questions, and we'll be able to take some as we continue with this discussion. As mentioned, we are recording this webinar, and our webinar today is titled Exploring Words That Heal, Harnessing the Power of Language to End GBV, that is Gender-Based Violence, and FGM, as well as elevating survivor leadership. And this is grounded on our ongoing engagements with survivors of FGM, as we recognize the critical role of language in prevention and protection. We will learn more as we continue on why we need to reframe the narrative around FGM. And as a start, I want to invite my colleague to share our first question, because we just want to know, how have you had FGM being framed historically or even currently? Like in your culture, in your community, or where you are based, how do people frame FGM? And so, Mark, if you could share the question. And we want to ask you to choose at least 3. I know it's possible to choose all of them, all 6, but kindly choose just 3 so that we can have an idea of how FGM has been framed from where you are based. Thank you. We'll give it a few more seconds. So it will be good to see your answers. Okay, Mark, if you can screen the answers. Okay, thank you. So out of the people who have joined, 81% say that it is a harmful cultural practice of those who have answered the question. We have 33% who say it's culture, and 10% say it's a crime. 29% say it's a rite of passage. 48% say it's a violation of human rights. 29% say it's child abuse. And then 33% say it's a form of gender-based violence. So thank you for these answers. I know that we'll get to understand more on why we need to reframe the narrative and what kind of language we need to use moving forward. And so to allow you to understand more about our program, I just want us to play a very short clip and then we'll move into the discussions. Thank you.
The Girl Generation program is currently in its third year of implementation. The program has been set up in 4 countries: Kenya, Somaliland, Ethiopia, and Senegal. So we intervene in 4 clear areas. We intervene and also direct support in community engagement, the making of grants, advocacy work, communication work, as well as what we call an integration program. An integration means we seek to see how efforts around ending FGM can also be placed in development sectors, right? Or some people call them government sectors. We realize that a key player in this work are survivors, because we do this work to respond to the fact that there are young women, girls, as well as mature women who have experienced FGMC, and no one has paid sufficient attention to what it means to survive the trauma of FGMC.
The Girl Generation, one of the tools I developed early on, is really bringing my activism and therapy work together. Because what I've seen over and over again is activists who genuinely are trying to do very good work. They work at a grassroots level. They are in the field, but emotionally they're at risk, socially they're at risk, physically they're at risk. And it makes you feel very isolated. So for me, one of the things I was very proud of was to develop an emotional well-being tool for activists specifically. One, what it did, it helped us build a community of activists. So we know we're not alone in this space. But also, I was very proud to share with other fellow activists my skills. So what was so beautiful about creating that tool was it was a co-creation phase. So even the other activists who were based in different parts of Kenya were sharing, actually, this is the tool I need and not this one. And that was a really beautiful experience. So the reason now it's the survivor-led initiative, because again, like I said, we are listening. And what came out of the training of all the 4 countries, the women now want to build their network. So you can clearly see the voice they hold and the power they hold. So for us, now this initiative, it's really to build a movement behind the survivors. So what I would say to others is really important that you listen to what those who are impacted and affected or violated by such horrible, horrible violence, listen, because they know more than anyone what they need, because we need to keep checking in to see, because we recognize the importance they are to this movement. And without them, we will not be ending FGM.
Thank you. Thank you so much, Mark, for that short clip. And I want to give a very brief definition of FGM, which is female genital mutilation. It comprises all procedures that involve altering or injuring the female genitalia for non-medical reasons. And it is recognized internationally as a violation of the human rights, threatening the health, dignity, and well-being of millions of girls and women worldwide. Allow me to introduce to us our moderator for today, Dr. Leila Hussein. Is a psychotherapist specializing in providing very crucial support to survivors of sexual abuse. And as the Global Advocacy Director for the Girl Generation, she's deeply committed to advancing the cause of ending FGM and advocating for the rights of women and girls. Dr. Leila has played an important role in ensuring survivors of FGM receive the necessary capacity to advocate for change through the Survivor Leadership Initiative. She's also been leading efforts to reframe the narrative on FGM and the crucial role of language in healing and allowing survivors of FGM to lead. My name is Anju Guna. I'm the communications lead for the program, and welcome, Leila. Over to you. Thank you.
Thank you, Anne, and thank you, everybody.
You
and thank you so
are
much.
muted.
I've unmuted myself. Can you hear me? Can you hear me?
I can hear you.
No.
Yeah, I can hear you.
Anne, can you hear me? Can the interpreters hear me?
Hi, Leila. We can't hear you.
Sorry? Apologies, everyone. Anne, I can't hear. Are you saying you can hear me or you cannot hear me?
We cannot hear.
So you cannot hear me, but the audience can hear me. The audience is telling me they can hear me.
Okay.
Yeah. So the audience is telling me, can you check if the interpreters can hear me?
Yes, we can hear you. Thank you.
Perfect. And guys, we have been rehearsing for this, but of course, this is when it happens, where they couldn't hear my voice. Yes. And I was saying, thank you so much, and for setting the tone of the space and for going through Safeguarded. So good afternoon, everyone who are here today. So my name is Leila Hussein. I'm the Global Advocacy Director for the Girl Generation. It's a really absolute, honor, and it's a webinar I've been really quite conscious of actually sharing with you guys today, because it's something that's very close to my heart. So I'm very honored to be moderating this conversation today in exploring words that heal, harnessing the power of language to end GBV, and how do we elevate survivor leadership. So that's really going to be the focus of what we're going to be sharing today. So at TGG, this is not just a webinar, this is part of how we support the movement. So these webinars are here to support the movement. The Girl Generation recently launched a position paper on the transformational power of language in action. And this is a space where we take this conversation forward to practice, to policy, and to people in everyday lives. Historically, this violence, which is also FGM, has often been framed as a matter of culture, tradition. I mean, you could clearly see that even from the polls that we did at the beginning. But what we are dealing with, it's actually a true violence. As we gather here today, I want to recognize that this Monday, it was June 16, marked the Day of the African Child. Sadly, it's a painful truth that FGM still remains one of the leading causes of death and harm among African girls. Every 12 minutes, a girl will die from this violence. So clearly you can see why reframing the language is very critical. FGM is violence. Touching a child's genitalia is a form of child abuse, sexual assault, and we must recognize it as that. Language plays a crucial role in prevention, protection, and healing. So today, we gather survivors, activists, policymakers, where we're going to explore how words can either reinforce, disrupt cycles of violence, and how they can ultimately help us heal. Because fundamentally, what we want from this is to heal. Just a little safeguarding note from my side. You're going to see me fidgeting a bit because I have back issues, so I just need to move around to make sure my back feels okay throughout today's session. So finally, obviously our team has given you the safeguarding note. We are always committed in creating a do no harm environment in all our spaces, today included. We honor survivors' voices and we approach this conversation with empathy and respect. Okay, so At any point, if you feel you need to leave, please leave privately. And if you need to reach out, please do reach out to the team if you need further support. So now that we've seen that great video, so I want to move us straight to our panelist. It is my pleasure to introduce today's panelists. We will hear from each of them about how language has been used in their work, their healing journeys, and their activism. We're going to hear an activist from Gambia, Kenya, and US, but also from the Asian continent. So I would like to introduce my first panelist, Zaytoun Mohammed, who is the founder of the Northern Aid Development Agency here in Kenya, but she's also an alumni of the Survivor-led initiative. Second speaker, I would like to introduce Dr. Fatou Bedle, who many of you on this call might already know of her amazing work in Gambia, an extraordinary leader from Gambia whose advocacy has really led to a global impact. I'm sure all of you have been following what's been happening in Gambia for the last year, and looking forward to hearing from Dr. Badle and her work. And finally, our last panelist, it's Maria Tahir, who is the co-founder of Sahia Organization and also part of the Asian Network on Ending FGM. So Maria and I have worked together in many years, shared many spaces together. So I'm really looking forward to really unpacking why changing the narrative is very critical to this work. So I will begin with Zaytoun Mohammed, and I would like to ask the speakers, obviously, to always have your camera on. So Zaytoun, I would like to start with you. How has the survivor leadership influenced your personal activism? You need to unmute yourself. Perfect.
Good afternoon. Thank you, Leila, for that amazing introduction. To start with, I think before SLI, I was passionate, but I was also carrying invisible wound. I had the fire to, speak out against FGM, but not always. I did not have access to the tools, the space, and the support. Doing it in a way that protected my well-being and empowered others. So the SLI Survival Leadership Initiative came in. It has changed me for the better. It gave me more than just skills. It gave me a sisterhood, strategy, and a strength. Through, I think, SLI, I did not just find my voice. I found a language of resistance and healing that speaks directly to survivors like me. And SLI also helped me to understand that my story is not just painful, it's powerful. It also trained me, to lead community dialogues, create safe spaces, peer support groups with my fellow survivors, engage with the media, challenge harmful narratives. I began to, reframe FGM not as a cultural identity, but as human rights violation for what it is that must end. Because of SLI, I've formed survivor support groups in Garissa, where I am. That is changing the way women relate to themselves and to each other. We don't whisper anymore. We speak boldly. We don't just wait to be invited. We show up and take the mic. Participate in the decision-making processes, the policy-making tables, have conversations with our leaders. And today, my activism is grounded. Before I even move to that, I think it also connected me to coming up with the formation of the national movement survivor lead with my fellow survivor leaders who came from the 22 hotspot countries, and also reaching out to. We know that the program, the TGGALM, is coming to an end, and it may not reach out to a larger audience or big, a good number or a group, of survivors, but us as survivors of SLI, I think, and as TOTs, being trained as TOTs, are taking up spaces, seeing how we can reach out to grassroots level, and that is how, today my activism is grounded on. I don't just fight for change; I model it. I know that when survivors lead, we don't just change policies; we change perception and we change life. So SLI has shaped me, not just as an activist, but as a transformational leader.
Zaytoun, can I ask a very quick question? Because as you were speaking, you reminded me of an example when, just to give a bit of a context to the audience, there was an incident that happened early this year where a Kenyan politician wrote a statement or said something where she was victim blaming. And the Survivor Network actually got together, right, Zaytoun? Maybe do you want to share a little bit? Because when you guys were writing that response, the language you used was very different to something you would have used before. Can you speak to that a little bit, that particular experience?
Yeah, that has actually, hurted a lot of people. It might have, maybe she has said it to maybe not cause harm, but maybe she knew that it would cause harm. But to us, it got to us from where we are, all the survivors in across, the world. The moment we had that, it couldn't sit well with us. Personally, I was just walking by the time I think that thing exploded, and I was called by a colleague, and I was told and she was like, "I've sent you a video. Why don't you check it out and see how maybe you can take that up and see what you can do about it." By the time I was listening to it, and I started coming up with a hashtag, using it on my Twitter platform, and seeing calling all my fellow survivors, and calling that this is something that is harmful, and this is something that is causing harm than good. And that is how we came up with a public notice, and we regrouped. As I said, SLI, moving from SLI, we came together and formed a group. So we have a WhatsApp group where we communicate easily, and we were like, why don't we join and come together and in solidarity, and see how we can address this kind of issue that's not good, and see if we can put a public notice out there and reach out to even the person who spoke, and a group number of people who may come and use. We have seen programmers who are program managers who are phrasing, am I using framing the words and in their programming as like some the words that are using are harmful, and it's not good and all that. So we are also taking up spaces like that and sharing that this is something that is it's harmful, and this is how we should reframe it and all that. So that incident did not sit well with us. We have spoken about it, and I don't think someone will ever come and speak publicly like that again in using that kind of language.
Thank you, Zaytoun. Maybe I can ask the CAM team, TGG CAM team, maybe if we can actually share that letter on the chat. It was really quite powerful. You can clearly see by having survivors at the forefront and writing that letter by using the actual language that needs to be used, and the impact that obviously had. So Dr. Fatu, I know you're on the call. I would like to come to you quickly. So maybe you could share with us how might framing FGM as a form of violence have influenced the legal responses, especially if you speak from the Gambian perspective. Can you unmute yourself? Perfect.
Yes. Good afternoon. Thank you, Dr. Leila, for this very important webinar, and to everyone for organizing it. My name is Fatou Balde. I am a Gambian. I'm a survivor of female genital mutilation and an active member of the women-led movement in the Gambia that is fighting to eradicate the practice. For me, I actually would like to start from my own personal journey with FGM. Even though I was a survivor of FGM, FGM was always sold to me as something that was beautiful. I never knew the terminology of female genital mutilation, even to start with, because that I was always told it's circumcision, it's cutting, it's in fact, if you go into my local languages, the terminologies that they use is very trivialized. It trivializes the pain of FGM. And that, in addition to the fact that people didn't talk about FGM until recently, the whole topic of FGM has been a taboo in Gambian society. It was until my university that I learned even the term female genital mutilation. And I remember sitting there and saying, what happened to me wasn't mutilation. What happened to me was my culture, my tradition. It's why are these people calling that mutilation? Because I was never opportune enough to have a conversation or someone to tell me that what happened to me was harm, was unjust, it was violence, and all that. It was sold to me as something that was beautiful. And for me, is that realization of the whole, entrenched series of misconception, deception of the practice of female genital mutilation, speaking on the context of Gambia, particularly, where people are misled to believe that this is beneficial for you as a woman, has continued to subject over 73% of our population to this practice. But moving forward, we have seen Gambian women resisting and now coming forward. Not just me, we have a mass movement of women coming forward and saying that female genital mutilation is harmful. I really particularly appreciate this conversation today because the power of language and how language actually is playing in the Gambia, where we have a group of men who have now gone to our Supreme Court to say that female genital mutilation does not happen in Gambia. What happens in Gambia is small cuttings of girls' genitals and dripping of bloods from girls. Not that that is acceptable, but their argument, again, just to trivialize what is happening to Gambian women, is this is what is happening and it should be allowed to continue in the name of culture and tradition and religion, which we all know it's not enough to continue the practice of FGM. So, yes, thank you again for inviting me here. And I hope that as we continue, I can speak more on these issues.
And Dr. Fatu, I think what you're reminding us is not just female genital mutilation we're talking about here. We're talking about all other forms of gender-based violence. We always minimize it by using the language, right? And also you're clearly highlighting this affects, depending on your gender, your background, ethnicity. Now it's like it's minimized to a certain level, because by minimizing it means we don't have to react as we should be, right? Because we should be outraged, which really brings me nicely to my question to Maria. So in what ways, Maria, has language used within a different regional or cultural context, such in Asia, and how is that reinforced, right, of the continuation of FGM?
Yeah, thank you so much, Layla, and for allowing me to be here as well too, and to speak about this. I definitely very much agree on language is incredibly important, both thinking about like how you connect with communities and talk about this issue, but also just how we frame it in a larger context and really recognizing FGMC as a form of gender-based violence and just kind of recognizing the dynamics involved and how they relate to other forms of gender-based violence too. However, as previous speakers mentioned, and I also grew up in a community and a survivor as well of FGMC, it's something that you grow up thinking is acceptable, that in different contexts it's justified to you, and so that's one perception, and usually it is until you kind of hear other framing or understand that other folks have been harmed that maybe your own mentality starts to change and you think about your own self as well too. At least that was my experience as well. And I think within the context that I grew up in and within South Asian communities, and a lot of what we hear within India as well too, is just first the framing of it as being FGMC. So the words that they use in the local language there are often katna, so other terms as well too. But just kind of again thinking of it, oh, it's not harmful, it's a religious minority right. So there's a lot of religious minority rights within India, and the communities that are known to practice it are within the minority within the country as well too. And so that's kind of one framing that you're seeing a lot about. But again, it's connected to the idea it's culture, it's religion. So it's something that isn't being viewed as gender-based violence. And that's kind of one shift. And we're seeing that just play out in terms of at the national level, legislatively, and in the Supreme Court in India as well, too. Right now, it's actually it's been in the Supreme Court for many years, this case on FGMC, but it's been grouped together with other religious minority right issues as well, too. But as advocates have been and survivors have been speaking about this, they've really been uplifting the physical harm, the emotional harm. Like, this is something that happened to me as a child. This was a violation of my rights, and really framing it as this is gender-based violence. And I think that framing has really helped to uplift the conversation within India. But still, those dynamics exist, and those um, uh, conflicts around recognizing it. The other piece of that is that when you're talking about it, there's this perception that FGMC is something that happens only within Africa. And so there's this, there's a racism that comes into play, but there's also this racial hierarchy that's being called out, even if people don't recognize that that's what they're doing when they're saying that as well, too. But there's kind of this image that, oh, the more violent forms of FGMC, as we all know, there are different physical forms, and the World Health Organization has categorized them as different types. And so kind of using that as an excuse almost to say that what we're doing is fine. What we're doing is okay, but we're not doing those worse forms. And so ours is kind of civilized in this, way too. And I think that has been really challenging, just because we want to recognize that regardless of the type, regardless of the form, it is all violence, right? It's all learned behavior that's continuing generation after generation too, but the separation is almost trying to excuse that this is okay. And one thing that I was actually thinking about a little bit earlier too was in the US. Another part of my background before I really shifted all the way into working into this was working in domestic violence. And also, I know within the domestic violence realm, marital rape in the US wasn't fully outlawed until like 1990s and across the country. But that was something that was considered acceptable as well, too, right? That was considered, and it wasn't considered rape. It was considered okay in the US because it was within marriage. And so that was kind of that justification that okay, but it's changed within this country now. And that view of it, that it's not okay, even if it's in the context of it's still rape. And so I think recognizing that regardless of the physical form of FGMC that's happened, that is FGMC, that is gender-based violence, is important. But just kind of recognizing all those dynamics and how we use language and how we define is really important in this work as well. So I'll just stop there for right now.
Thank you, Mara. I think also maybe something I wanted to, because you and I had many conversations about, especially the race aspect and how harmful that can actually be to Asian women. And if I use an example, so in my private counseling practice, a lot of my clients are mainly FGM survivors, and I have two Asian women. And what I've realized when I go to my supervisor to discuss my cases, what I have noticed quite quickly with the Asian women, the route to the healing is actually calling it for what it is first, because there's a massive battle in therapy to really come to this, come into term and recognizing how harmful that actually was, because by not recognizing such violence, you will see there's a pattern in every part of their lives where they've allowed bad things to happen because no one came to the rescue, no one actually named it. So it's quite interesting by just not giving someone how harmful this can actually be. So thank you so much. So Zaytun, I want to come back to you quickly. I think what will be really good, because you touched a little bit of how language and spoken and written word and written work has really played a key role in your healing journey. Can you maybe speak to a little bit about the impact that has had on you by reframing the language and really beginning the healing of recognizing this was actually violence and not your culture? Zaytun, are you there? Is Zaytun there?
Yes.
Okay.
I need to unmute and put on a camera.
Okay, don't worry. As we get Zaytun, are you here?
Yes, Leila, I'm having a little bit of technical issue. Sorry.
Okay. Did you hear my question?
No.
So my question was, I know in the past when we've spoken at different sessions, you've spoken to how reframing the language has really been the beginning of your healing. I think, do you want to speak to a little bit what that looked like, what that healing was like for you?
I think to what I believe, language has been both a wound and a medicine, and can be a wound and a medicine in any survivor when it comes to their healing journey. For many years, since I started. Sorry, I just realized my camera was not on. So for so many years, before I think I joined my advocacy journey and my activism, I used to back off a little bit and not speak about FGM because how they frame FGM was a bit different from how it is now. Since NGOs have come and did a lot of capacity building, a lot of community sensitization and awareness, it has really changed. But before, you were called victims of FGM. You are called unclean. You are called even when potential husbands want to come and marry you. The first thing that they actually questions that they normally ask is, have you been cut as a sunnah or as a Pharaoh type? So what type it is? So by the time you're speaking that language to us, it's actually damaging us. As survivors. So this is something that has been happening for a long time. I didn't want to come out and speak about ending FGM or have campaign against FGM because of these words. And these are words that are harmful. These are words that are getting to you, and you will not be courageous enough to speak when the attitude and the behavior of your community is just like that. And the words surrounding this in my community were used to silence pain, and they to normalize harm. And those terms like sunnah, and you're not unclean, don't even talk about it. That time at times, I think back in 2 years ago, 3 years ago, I used to volunteer and do mentorship talks in schools. And by the time I speak about this, religious leaders or the religious leaders that teach the Islamic teachings and all that would have a side chat with me and tell me, Hakahalin, like, don't talk about that. Why would you stand up and talk about those kind of issues? Are you not embarrassed? Are you not coming from a community that feels like it protects the dignity of you? But the dignity of girls are not protected by silencing them. And preparing a potential husband for you to be prepared to womanhood and also to be married off. You have to go through there were so many norms, so many attitude and behaviors, negative ones in the community. And because of this, and we had to my healing actually began the time that I participated in SLI. Let me be honest with you. I found solidarity with the other fellow survivors, because by the time I stepped in that room, I knew that I was not alone in this fight. Before I'd realized that people want to speak about. There's a time I wanted to start a campaign against FGM, and I was like, let's go and knock into these politicians, offices and all that. But I ended up being alone there. I think we were only 3 girls. The rest just, decided not to go. Why? Because the community is silencing them. So, but my healing began the moment I found language to name what happened to me, not as culture, but as violence. And saying I'm a survivor rather than I'm damaged helped reclaim my identity. Calling FGM a violation of my rights allowed me also to see that it was not my fault. Through Survivor Leadership Initiative, I learned how to speak about my experience in ways that honor my pain but also my power. Through spoken words, survivor storytelling, and even writing statements on social media posts have helped me express, what had been, locked inside me for years. So today, language is how I heal, Leila, and how I help others to heal. Whether it's comforting a girl in Garissa with the words like "Wankugarap tagane," like "I'm with you," or speaking, in national platforms about justice and dignity. I have learned that words can speak and can break cycles and of silence and stigma. I now choose words that validate, uplift, and empower, because language has become a tool for survival and leadership and also collective healing for me. So
Well,
it's
thank you so
it's a long
much.
journey that I came along.
Yeah,
Not-
and it's an ongoing journey, and I say this as a survivor myself who also is in this space. I think even just you being on this call and many survivors who have joined this call, it does feel less isolating. So thank you so much for sharing that and continue to remind us. I mean, I know my healing genuinely began when my professor, I was trained as a therapist, said to me, Layla, what you experience is one of the worst forms of child abuse. You were tortured as a child. And you can see the beginning of having that breakdown from that experience, but it led to this journey today. So thank you so much for reminding us of that, Zaytun. So I want to come back to Dr. Fatou. I mean, Dr. Fatou, clearly you can see, I mean, I can safely say, I think for everybody, that women's rights globally are currently in danger, extremely in danger. We know that. But I wonder what lessons can the global movement against FGM learn from what happened in Gambia?
Thank you.
Yeah.
Thank you. And thank you to the previous speaker. As you rightfully say, every time we meet as survivors, it's so empowering. It reminds us that we are not alone and we are a movement. We may be in different countries, but we are speaking the same language and we have the same aim and objectives of seeing FGM coming to an end. The previous speaker's words were very powerful. Thank you for sharing that with us. Yes, in the Gambia, and I think what we are seeing, particularly, for example, in the Gambia, the attacks that we are seeing on FGM is not an isolated issue. It's part of the broader umbrella of attacking progress that has been made towards women's rights. I think for us in the Gambia, FGM is an entry point. FGM is an easy access, an easy subject, because even though we know it has a huge impact, but because of, again, the use of language to minimize the harm of FGM, other people with bigger agendas of attacking women's rights, who have the intention of suppressing women's advancement, are using FGM as a tool, as an entry point to regress on women's rights. But also in the same vein, as I always said, I've never seen Gambian women come out and fight for their rights. We went through a dictatorship of 22 years where several human rights abuses were happening. Women never came out to fight for their rights. But when this issue of FGM came up, even though we talk about the culture of silence around the whole issue, women saw what was at stake. And I think it was scary, but it also sparked. It ignited women's passion in saying that we must come out, and what we are doing, we are not just doing it for Gambia, because we know that if we lift this ban, if this ban in the Gambia is lifted, countries like Sierra Leone will use Gambia as an example to continue practicing FGM and refuse to pass laws around FGM. The precedent will be set in Gambia where other countries with laws of FGM can also come out and say, this happened in Gambia, we should also try and undo the progress that we have made. So I think that, and the battle still continues. So because I don't think everyone is aware, even though the ban was maintained in our parliament, the same pro-FGM have now gone to the Supreme Court to challenge the constitutionality of the ban, claiming that it it violates the right to culture and tradition and religion. On those bases, our Supreme Court has taken on the case, and we are taking back to that what happened last year of continuing to fight to defend the law, because we know this is not just about FGM. This is about controlling women. We know the motive around FGM. As I often say, when you take a little girl and you cut the most intimate part of her body, you are not just condoning, you are not just performing FGM. That's one aspect, but you are also telling that girl her body doesn't belong to her, and that other people have a right to violate her body. So FGM is the first stepping stone of violence for women and girls. And this is why it is so important that we tackle FGM. If we cannot tackle FGM in practice in communities, we cannot tackle domestic violence, marital rape, and other forms of violence against women. They are all interrelated. Thank you.
Yeah. Thank you so much for sharing. I think when the whole issue in Gambia came up, I think one of the things I'm grateful for, it's what it did. It really like united all the other movements in different parts of the world. I think we all had to get together and really think together and think about, because it really was a scary thing to watch. That again, I mean, like I said at the beginning, when I said earlier, women's rights are being pulled apart everywhere in the world, but this was actually part of that. So I'm glad. I mean, it's still ongoing. I don't think any of us are out of the woods when it comes to this, and how such legal frameworks and policies really impact on how we end this horrible violence against women and girls. Mari, I want to come back to you. So now that Dr. Fatah shared that, what she just shared, I mean, how can we ensure that the terminologies we use in the movement to end FGM truly fosters healing, empathy, unity, inclusivity, rather than causing confusion and divisions? And now that goes into like stakeholders, donors, communities, advocates. How can we ensure that we all are coming from the same page?
I think that's such a good question. And I was thinking just about language, and also how I mean, personally, how I and Theo work within communities. And I know for us, one of the things is with survivors, and this is across the board, survivors of all forms of gender-based violence. I think it's important not to define for them their experience, right? Like, I think they need to be able to define for themselves. And you talked, Layla, about your own clients, right? And like them coming to terms and naming it in their own time and space. And I think that's incredibly important too. And so when we're talking about terminology and framing, I think it can be very helpful towards healing to start to name and bring those conversations up. But I don't think that you can definitely just say right there, like, you experience violence. Like, they have to come to terms. And sometimes part of that is also maybe making the connections, the dots, introducing that. And that's for communities as well, too. I think about how validation is so important, but also just like helping folks to feel less alone in their experience too, in that larger context. So that's kind of one group, one community as well too. But then when I think we're talking about uh, policy, or we're talking about advocacy, international agencies thinking about that larger movement, really naming it. This is gender-based violence. This is child abuse. This is a human rights violation that needs much attention, and recognizing the intersection of FGMC with many other forms of social oppressions as well too, right? We were talking about racism and how that impacts FGMC earlier, looking how it impacts lifelong gender-based violence, as Dr. Fatu was mentioning earlier too, like other forms of it, how it can impact just so many other things as well too. And I think that um, being able to really clearly connect those dots, and really being able to uplift that this is a intersecting human rights violation that definitely has dire consequences for women around the globe is incredibly important too. And I think when we're talking about being inclusive, just recognizing again that all forms of FGMC, many people that are impacted by it, that it's not just with, and I'm saying this from the US context too. In the US context, one of the challenges is it being associated with just immigrant and refugee communities. And so that leaves out a lot of populations. It leaves out myself actually, because I was first generation born in the US as well. And I come from the South Asia background. So like both those things I'm left out of that context, but that under recognizes the extent of FGMC. And then there are other populations that are impacted as well too. And so just kind of when we're talking about it, I think also talking about it as a global issue and recognizing it's a global issue um, is incredibly important too. And I think I kind of lost my train of thought for a second too, but I do think it's really important just to kind of uplift for survivors and framing it as a global issue, recognizing there isn't one form that's worse than another form too. Recognizing those connections is incredibly important. And just I often think about like FGMC as a social norm, and there are many justifications. Culture, religion are a couple of those justifications, right? That's not unique to FGMC. We see that in a lot of other forms of gender-based violence as well too. And I think recognizing that there can be harmful things in many different cultures and communities is important, but to uplift and say that this is violence and this isn't something that we should attribute to culture or religion, even though those are being used as justifications. But a lot of that is around education and really being able to uplift those frames and for larger audiences, whether it's again policy education or also working within communities. But it's how you do it too that I think is important. Hopefully that answers the question a bit.
I think, Mari, I wanted to have a little follow-up in terms of how, because of what's happened with the recent US aid cuts, how is the US, I guess, networks or survivors in the US being impacted? Maybe you can give a bit of a context to what the recent administration it's comparing FGM to give the audience a bit of a context to, yeah, because that's also framing it in a different way, right? And the impact that's having. Yeah.
The conflation piece that's happening right now. So for those who don't know, this is actually really huge in the US, and it's becoming it's something that started a few years ago at the state level, and we're hearing conversations, but now it's just kind of blown up with our current administration. But we're starting to see essentially a lot of conflation between the issue of FGMC and gender affirming care. And for trans youth, but also other folks that have access or need gender affirming care for other medical health reasons as well too. And it's FGMC is being co-opted basically to say that gender affirming care is FGMC too. And so there are attempts legislatively to include that as part of the definition. And so one of the things that happened in the last few weeks was the US does have a federal law against FGMC, and that has been its own roller coaster over the years as well too,
exactly.
which I won't go into, but there was a law that strengthened it in 2021. And actually during the first Trump administration as well too, it was signed into law. And that was very much had a lot of support. Many advocates rallied against that, or for that, not against it. And it was really a big win in the US. But what we're seeing now in this second term with the Trump administration is they're trying to call gender affirming care chemical and surgical mutilation. And so there have been executive orders that have gone out, and then there have been a lot of controversy. We've also seen advocates fighting back. Don't touch the FGMC law. Don't try to conflate it with this other issue. We're also seeing in the last couple of weeks, there was one legislator who introduced a bill. It's called the Children's Protection Act, if I remember correctly. So again, talking about language, really trying to frame it in this way that makes it sound that it's appealing and helpful, but really what it's doing is trying to ban gender affirming care. So it's trying to add in these components and say surgical chemical mutilation is FGMC, and so we need to ban all of this, but it's taking away from the real needs of survivors and advocates who are impacted by FGMC. And we have done so much work in the US in the last 10 years specifically on this issue, and really trying to bring attention that there are survivors here. There are individuals that are at risk. We need education, outreach. We need funding to support, in the country as well, because it was oftentimes so much thought of as happens in other places. So individuals that lived in the US were not getting support or resources. And then now to kind of see it being co-opted in this way, and there's fear that if this bill passes, I mean, it will be targeting children in many vulnerable communities, FGMC survivors for sure, but also other individuals that identify as being, part of LGBTQI communities and trans youth as well too. And so it's really pitting children against each other and vulnerable communities against each other, which is just honestly, it's really disturbing to me too that this is happening. But advocates have really started to rally again around this and doing a lot of call to actions. There just was released, I think today, a global call to action to try to get many other NGOs just to help support this recognition and to kind of show that global solidarity, that we got to see with the Gambia as well too, and hoping that we can get some global solidarity around this, because we're also afraid of a ripple effect of this. If this happens here, could that happen in other countries and regions around the world as well too? Yeah, so it's framing in a way that is actually threatening to the movement that we're seeing there.
Yeah, because that's the whole point, where language can either harm or do good. And this is really a great example when it really, that hard work can now, can disappear because of how it's now being framed, which is really shocking. Every time I hear it, I'm like, actually, I can't believe they're framing it as that. So thank you for sharing that. Zaytun, I would love to come back to you. I think, again, we can see the risks language really can have if you don't create the right environment or really go and educate yourself on how to do this. So my question is, in your view, how can we, it's not just on you, by the way, this is, we're all responsible for doing this, but how can we change the way society talks about survivors? And you touched on it a little bit earlier, but how do we ensure there's respect, inclusivity, and there's no harm and only could be a space for healing for survivors? So can you share a little bit of a view on how society can change and how they talk about survivors?
Thank you, Leila, for that question. I think to start with, in our programming, we need to make it survivor-centered. I'm thinking maybe we are listened by programmers, program managers, who draft budgets and proposals. So when you're coming up with activities, they should be survivor-centered. The use of language when you go and disseminate this information in the community is also something that is very important. And for me, I'd say breaking the silence and challenging the harmful narratives that is surrounding FGM. We've been using this word. This word, actually, I'm really tired of it. Calling FGM a sunnah and calling it, being called a victim. It's tiresome for us. And, we also, must begin to name it, like call it a harm and, and clearly, without, without fearing. And I think for you, if you are an activist or a frontline activist or an advocate, some of the things that you should have is like you should be courageous. You should be clear about whatever that you're telling someone, and you should have boundaries created, because sometimes people can disrespect the kind of boundaries you've created and break them. So we need to use right-based languages that describe FGM as a violence and not a tradition. We must also, stop calling survivors cat girls or victims, as I said. And secondly, I think we must ensure that survivors lead, the conversation. We are leading the conversation. So, and I'm going to use, a quote that was said by Saadia. that the wearer of the shoe knows where it pinches the most. We know the solutions to these problems. We are born from this community. So by the time we are getting up to advocate against these vices, we know how to, end them. So, but through SLI, those are some of the skills we've been taught, some of the things that we've been practicing. How can we've been pitching and doing a lot of public speaking practices, and how can we go in our communities, how do we go about framing words and all that. So as survivors can come together and lead these conversations and share the stories. I remember there's a time I was doing a community engagement somewhere in one of the sub-counties. And by the time I stood up and, started speaking about FGM being a violation of human rights, I think a great percentage of the people who were listening to me walk away from the sitting. Simply because I think this is still tied to cultural tradition and all that. So these are some of the things that we need to do as survivors collectively to, reframe and at the same time, use in our community initiatives. Because it changes how the community understand the issue. And another thing that I think can also work is use these community gatekeepers. There are people who are really influential, like even politicians. I've never seen a politician standing up and talking about ending FGM, and they are doing campaigns right now as we speak here in Garissa, but none of them is speaking about this language. How can we have them on board is the question. How can we see, because these are people who are influential. These are people who have representation in the parliament where decision making happens. So how can we bring them and see how we can, work with them? And because they're also coming from the community. So we also need to train the media, the community leaders, the religious leaders, to use, trauma-informed and respectful languages. Sometimes you'll see media coverage is being done and they're using the victim, unclean, uncut. Those are not the words that we need to use. So I'm thinking even the healthcare workers, I once was, I'm summarizing this. There was a case that we were following up, a GBV case, and a healthcare practitioner happened to sit next to me as we wait for the medical results to come in. And while we were having this conversation around this issue, he raised that, I don't know why you guys are tirelessly working around ending FGM and, GBV in general. Is it not something, I don't think it's worth it, because it's not going to end. At the end of the day, I had to post a question to him and ask him, today, if you were to marry a lady, what are some of the things you would look up to? And he's tailoring it to what I just said, and he's saying, I'd probably marry a girl who has not gone through FGM. So what happens to us who are survivors of FGM? Who's gonna marry us? What is gonna happen? So the kind of languages that they use is also harmful, and you can imagine that getting it to a survivor as someone who we are, trying to take her through, getting medication and all that. So we need to train them. I think there's a gap in that. There's a time, the same case, some people who are working in some department in Garissa County, and I have had interaction where we had to, bring a survivor to the police post, where the police station where she was to write her statement, and the kind of words that they're using are not survivor centered. They are kind of words that they're using to to talk to the survivor is not welcoming. It's not something that can even make the survivor write as a correct statement. Sometimes even you'll see that survivors are lying about these statements because they are threatened, or their family are threatened and all that. And that is when I had to talk to an officer who's posted here in Garissa, working for Action Aid, to see if she can do a safeguarding training for these people, because that is what we need right now. So these are the kind of gaps that we have realized we have as stakeholders from Garissa, and we are seeing how we can, have pull resources together and see who can do what, and train this media, local communities, and all that to go and speak to the community like that, and with the words that heal and words that are powerful. And lastly, I think we must create spaces for an inclusive narrative, which we are doing right now. We have formed survivors groups here in Garissa and training them on the same different, ages, backgrounds, and identities, including those with disabilities, and see, like how can we make this inclusive, and how can we also make them feel seen, heard, and valued. So words have
Perfect.
power to uphold violence or dismantle it, and this is something I've mentioned when I was starting. So if we change our language, we can shift mindset. If we, center survivors, we can also change the story and, maybe end this cycle of harm.
Perfect. Thank you so much, Zaytun. I think also it's a really good reminder, even though our focus today is around language and the leadership of survivors, I want us to not think now this is all on survivors. I think is really important. Survivors are a big part of it. They're maybe at the forefront of it, but it needs all of us to be part of the movement. And I think it's really important that organizations, platforms, movements really begin to think about how their systems are supporting survivors of violence when trying to do this work. And like I said at the beginning, we're all trying to do good work, but sometimes if we don't check the system, we could be harming survivors who really generously offer their stories to ensure change actually happens. So I just want to do one last question to Dr. Fatu and Mari, and actually it's the same question for both of you. So what words or phrases would you find most empowering when talking about change, resisting, hope on ending FGM? Dr. Fatu, can I start with you? And then Maria. If I can give you 3 minutes each to respond. Thanks.
Sorry,
Dr.
Dr.
Fatu, are you there?
I just missed the question. Yeah. My internet was fluctuating.
No problem. I said, what words or phrases would you find most empowering when talking about change, resistance, and hope in ending FGM? In your words.
Yes. So for me, survivor, it's one, because as it's important that we do not consider ourselves just as victims, because when we do, we are still at that same place. But when we survivor means you have a voice. You are not in that same place, that you've now realized what happened to you is in the past. You are dealing with that, but you also have a voice to challenge. So I continuously use the word survivor for FGM. But also I have an issue with culture, because what we find, particularly in the Gambian context, even within the space, we find where the international community, UN agencies, and other institutions working on women's and children's rights would still take a step back because they don't want to offend culture. By using FGM as a cultural practice, then other people outside us are like, but if we come in, we will offend them because it's cultural. So we need to see FGM as a violation, as a harm, as an abuse, and under that broader umbrella of FGM, of violence against women. And I think also we need to start looking at FGM not as an isolated issue, but under women's health. Because when you look at FGM as an isolated issue from all the other women's health issues, you also face this challenge of let's treat it as a culture and tradition rather than the harm that it puts on women and girls. So for me, again, using FGM, I put it under the umbrella of women's health, women's rights, but also seeing FGM survivors, as the voice within our communities that are effecting change.
Perfect. Thank you so much, Dr. Fatu. Maria, same question.
Yeah, I was thinking about really just, I was thinking about community, but I was thinking about breaking isolation and building community and how important that is, and particularly in this movement, in this work too, and recognizing that you're not alone. that validation is important. One thing that came to mind was we did a study years ago to try to understand why some individuals who were survivors and coming from communities within the South Asian Bora community would speak up publicly and some wouldn't. And really, part of it was realizing that some folks don't have individuals around them or a support system. They're the only ones that might think this is wrong, while whereas other people who might have a support system feel more comfortable and can speak out as well too. And so that's something that I think about in my own healing too, was just like building that community, that solidarity, that um, recognition that we're not alone and how that important for all of our healing journeys as well too. And so I think when I think about the words, those are that what are coming to mind right now for me is just breaking isolation, building community and that solidarity, just gaining validation that this was violence and that we experienced this and none of us should have experienced this at all. But realizing that you're not alone, it there is something that helps find it healing, and when you, especially when you can talk to other people about it as well too. So I'll just end with that.
Thank you. Thank you so much, Maria. And I know there's a few questions. I've done my round of questions, so thank you so much. But I'll come back in few. But I just want to open the floor and reflections from the audience. So I'm going to pass it over to my colleague Jacob, who has been watching all the questions. So Jacob, I'm going to ask you to unmute yourself and yeah, please read. And I'm going to ask the panelists if they can respond to some of these questions.
Okay, great. Thank you so much, Leila. And thank you, Fatu. Thank you, Zaituni, and thank you, Maria, for this insightful conversation. And so I'm just going to take a couple of questions that are on the chat. And one is, and of course, this one, Leila, you can probably respond to this, where they're asking, is the SLI still in Kenya?
So we have the network in Kenya, but we don't have, we wish we could have more cohorts of SLI Kenya. We're hoping we can in the future do that. I remember the first time when we did it, I remember we sent an application, the link, and within 24 hours, we had over 300 women who applied within 24 hours. So we know there's a massive, massive need for such spaces. And I really want us to think, and I always say it's not just space. I want other organization, anyone on this call, if you are dealing with survivors of violence, this is the kind of initiatives that we need to be creating. So yeah. Thanks.
Thank you, Leila. Thank you, Leila. So before I open to the audience to interact, let me just read one more question that's coming up, and we can, Leila, you can guide on who responds to this. So our world is changing fast with technology, healthcare innovations, and climate change as an example. Are we seeing or able to predict new trend within the FGM space as a result? I can imagine it depends per context. Yeah, so that's where the question ends. Can I read
I don't know if
again?
the panel read it one more time. And but the
Okay.
panelists, please put your hand up as Jacob is reading the question. So I know you want to respond to this question. Thank you. Go ahead, Jacob.
So our world is changing so fast with technology, healthcare, innovations, and climate change as examples. Are we seeing or able to predict new trends within the FGMC space as a result? It's a really, really good question.
Maria wants to respond. Go ahead, Maria.
Yeah, just one good trend that I'll say is the fact that we're recognizing FGMC as being global. And I really think that that has happened in honestly the last like 10 years. It wasn't something that was really uplifted, but I have been in many more spaces now where I see that I'm not like the only person connected to an Asian community or, from the US as well too. Whereas in 10 years ago, I felt like I was one of the only persons, but now we have just that kind of that representation. There are more organizations, individuals that are doing research, trying to carry out programming, trying to support survivors. There are more survivors that are speaking out too. And so I do feel like It's not a trend in that it's suddenly increased FGMC. It's always been there. It's just that it wasn't being spoken about as well. And so I think that has just been really powerful to see that we're breaking that silence globally, because that we can't address it if we don't name it, right? Like we're talking about framing naming. So if we're not naming that it's happening globally, we can't address it globally. And so that's just kind of one trend that is been good for the movement.
Great, great. Thank you
Can
so
I
much. Yes, yes, yes.
yes, on the other hand too,
Go ahead, Dr. Fatu. Yeah.
yeah, the fact that these changes are occurring means that other things are taking priority. FGM, it's a violence against women, but also, as we see in most instances, it's considered as something that happened to. Okay, sorry, saying the whole style. Okay, yes. So it's often seen as something that happens to girls in Africa, and it's not seen as a priority. The fact that it's 2025 and we are still talking about girls' genitals being cut at such a high prevalence indicates how little focus is spent on FGM. The attention it deserves, it's not receiving that. So other areas of like climate change, technology, advancing, all that, and all these other global issues that are coming up are taking more interest than FGM. So this also signifies the need to really accelerate efforts, the need for survivors to continue advocating for attention and support towards ending FGM.
Thank you very
Thank
much.
you.
This one more, and Leila, you can guide on who jumps on this. Advocacy for FGM as a beginner is quite not easy, especially without a good support system. Some tips for beginners, please. Does anyone want to chime in on that in
I wonder
brief?
if Zaytun, would you like to respond to that? On how you began your advocacy work, and what would you share as a good example? Okay, I can't see Zaytun. Maybe Mari, can I ask you and Dr. Fatu to respond to that question? Yeah.
Yeah, I think one thing for myself, and then what I've seen other people, I took a very long time to get to this kind of more public and working on an organization. Like first for me, it was honestly, I just wanted to learn more about why it was happening, and the and so I did that. I read articles, I contacted individuals, and I kind of wanted to learn more for my own healing and understanding as well too. Um, and then gradually, as I was talking to others and developed mentors, and people started to help me kind of understand, if I became more public, what would that mean for myself? What would that mean for my potentially my family and everything too? So I think I really appreciated being given that space and that guidance, that it's okay to take some time to understand kind of what your advocacy comfort level is, and that might change over time as well too. But the first step for me was really just kind of reaching out, learning more, whether I was reading an article, was watching a video, or talking to somebody, or reaching out to organizations that are doing this work, and seeing, is there a way for you to be involved as well, and what's your comfort level? So I would really encourage you to do any of those things too, especially if you're very new into the space, and or you're just trying to understand like what role can I play as well.
Perfect,
Thank you so
Mari.
much.
Zaytun wants to respond.
Oops. Okay. I'd say it's not an easy journey. But again, you just need to be courageous enough. See if you can do. I'd say not walk alone. Try collaborating with like-minded organizations or activists. See what you can learn about it. In your advocacy journey, should be more of like learning for you. So every time, try learn new things. Try collaborate with them, and you can just start with with what you have. You don't necessarily need a big grant to manage, or to apply for. You just need, the little things that you have, the little knowledge and skills that you have. Start practicing it, to go to maybe schools, do mentorship talks, or even participate in webinars. Try see with your organization if you can have arrange talk spaces where you can, become a moderator or a speaker, tackling different issues, talking to different topics and all that. And I know that advocacy can be really heavy. And the reason why I'm saying that is like you'd be hated on. Your community might even disown you at some point. It's not an easy journey. But also be courageous enough. I'm not going to say that maybe just make you feel that you are not enough and all that. But what I'm just trying to say is just become what is it called, so powerful and so courageous to take up spaces, any spaces that you may see and all that. And maybe you maybe research a lot about an issue before you speak about it. Sometimes you can say something and may not sit well with some people. So maybe you can also do that and collaborate a lot. I think I'll just sum up by saying that. And if you need any help and all that, maybe you can reach out to any of us or Leila and the people who have arranged this webinar, and all people that you know.
Yeah, actually, someone at Options on the call, if you can share the youth advocacy tool, that's a really good tool to use if you're a beginner. Even the SLI guide really speaks to this. Our Do No Harm guide. So, I mean, for one, like everybody said, connect yourself to an organization was that kind of, it keeps you physically, and you're physically safe and you're less isolated. But obviously, make sure you're very much aligned with the organization as well. I think that's very important that you have an honest conversation. Are me and this organization on the same page? I think that's number one rule. But also be honest about, be realistic about what you can give. I think I wish someone told me that very early in my activism. Like, hey, are you good at making tea and printing? Great, do that, because that is also needed in the movement. It doesn't have to be the biggest. So really check what your limitations are, because every effort is extremely important, as all the other effort. The person speaking on stage, the person who made sure that speech was written, equal impact they're going to be having. So I think it's important to check that with yourself.
Okay.
Let me just
Leila,
check for
there's
time.
more? Okay,
Yeah,
there's
maybe
one more.
and then we can open it to the audience, right?
Okay,
Because I know we have to do another something. Yeah.
And
Okay,
I
great.
see Keegan's hand has been up for a while. So
Okay,
Mark, and do you want
perfect.
to help Keegan unmute as I post this comment to Leila? So Leila, there's a comment here. Is there a guide or a document that can help someone like me, Luyinda, Gloria, to learn the appropriate language to use when talking about FGM? I want to be sure I'm using the right words, because sometimes I might say something I believe is okay, but it could come across as harmful or offensive to others.
Perfect. We do. We have a position paper. Again, we'll share it in the chat. I'll make sure. So really, and we made it so much easier for people to read and just follow the instructions of that paper. Thank you, Jacob.
Keegan, do you want to?
Yep. Unmute yourself
That
and
is
ask the question.
Yeah, thank you so much, Leila, for everything. For the sake of the audience, my name is Keegan Kagwe. I'm the National Coordinator for Youth Anti-FGM Network in Kenya, and I'm also a beneficiary of TGG because I'm part of the youth cohort that helped also develop the Youth Advocacy Toolkit. And so I'm happy because I remember, Leila, you mentioned, was it in Italy that 44,000 plus girls are dying every year in Kenya? And this is safe for malaria and other
No, in Kenya. It's Africa.
It's in Africa, yes. And so I'm saying, like, in malaria, the context is larger and the funding is more. So we can imagine what is happening. And also we are seeing there's a very huge pushback, especially on all progressive institutions like UN. I was reading somewhere that CSW 68 already, the words like gender-based violence, SRHR was really coming down. And so, and also with the budget cuts with USAID, the KDHS is funded heavily by them. So what kind of data are we going to get? But I'm happy with this and the position paper, and I want to quote the rapporteur for harmful practices who said this is thought-provoking. So for me, maybe I'd want to maybe note and ask 3 critical questions. Number 1, is there an opportunity to capacity build partners on the power of language in the language that we use, and so that can also help us refine what we are doing and the work we are already doing. Recently, we are doing a youth capacity assessment with support from ORCID project, and what we want to know is young survivors are asking very critical questions, and the answers they want are heavy, and so we are ready as young people to work on it. And also the other thing I'd maybe want to inquire
apologies, Kate. Carry on, Keegan. Sorry. Yeah.
Oh, okay. Yeah. So in also I know there's something that we do in Kenya. This called the gender audit tools. Like in your organizations, are your documents and policies and the work you do gender sensitive and all that? So maybe with this, can you help us as CSOs maybe have like a FGM language audit tool in the reports that we do? We saw the research case that was there. We did a statement. There's outrage. You really want to put your voice out there, but you may end up again re-traumatizing survivors in what you're thinking that you're helping, but yet you're not. So can we work on something around that, and also maybe even build evidence around the power of language? Because I remember we were in Maseru, and that is the critical question that was coming from the rapporteur. What evidence is there? Yeah. Initially, they were saying FGM has health consequences. Now there's research to back it up, and so it's now becoming a conversation. And lastly, I'm sorry to take much time. Can we contextualize this language, especially in conflict settings? We know the northern eastern part of Kenya and areas like Somalia, there's no rule of law, there's no leadership. So how, again, if you want to really criminalize and say FGM is a form of violence and you want to criminalize this practice in areas that are conflict prone, how do we work around it, and how do we support survivors without, again, putting them...
Sorry, I lost sound. Did I lose Keegan, or is it me? We lost Keegan.
He stopped.
Can you guys still hear him? Okay. Well, I was going to say to him to get in touch with the CAM team. And also, I want to just, by the way, we don't use the language where we say a country is out of law or they have criminal issues. I don't think we want to say that. So I just want to, I know that's not what Keegan meant, but I think it can be framed as that way. So I just want to really highlight that that's not the language we use at TGG, and that's not the language we encourage for others to use. And if Keegan comes back, or anyone has Keegan's details, it would be really good for the CAM team to help support in terms of how they ensure the use of language and supporting survivors, so we can really support that work. Thank you. All right. Wow, it's already half past. Is there another question or something from the audience? Can I ask Jacob, is there any?
Rumana has her hands up.
Perfect. Can we get Romana to, and please keep it very short, huh?
Mark, and are we able to help Rumana speak?
Yep, she's here.
You can hear me?
Yes.
Yes, thank you so much. I'm happy to be here with you guys, and I've been following the conversations. And thank you, Leila, for this session. So I just want to maybe to ask one question, or maybe to just add something. And I think one of the key thing is in ensuring that we are saying we are putting or calling FGM for what it really is, and we don't need to be unapologetically about it, because FGM is an act of violence, which is we need to call it for what it is. It's a violation against women and girls, and coming from the marginalized community, I think this is something that often we don't like talking about it. We like putting a very good name across it so that we can escape whatever it means. So I think for me is it's one of the things I have to call it for what it is. It's a violation, and it's a violation. It's an abuse. It's an abuse, and it's a female genital mutilation. It's no longer a cutting, but it's a mutilation. And then one of the things that I want maybe to ask, as coming from the hotspot county, Mandera County is I think, is the second hotspot county with 97% of the preference, which means a lot of girls are being cut every now and then, which are hidden. And looking at in terms of FGM leads maybe activities or actions, it's very low in terms of in our county. So I just want to maybe request or ask, maybe in what ways can we partner, maybe, or can you guys maybe scale up the survivor-led fund, so that we can be able to maybe reach more people with awareness, because currently we are at the stage of awareness. Because if we say prevention and we're not creating awareness, it doesn't mean. And as well, if we are saying we are at awareness, that's that reporting is not also there, because no one knows how to report, no one knows where to report, and no one knows maybe how even to start, where to report, and even those maybe the pathways and all that, they don't even know, because they don't have awareness. So I just want to maybe to urge, maybe if the survivor-led fund can be also scale up for other counties as well, so that we can help more people. Thank you.
Just want to clarify one thing. So when we did SLI in Kenya, we opened it to all the counties. I think we had over 22 members, 22 women who came from different counties. Currently, we don't have any funding for SLI. I think the remaining one is the one in Ethiopia, and that's for the Ethiopian women. But hopefully, I mean, we can't promise anything with the programs coming to an end. I mean, you've seen how this sector is extremely, just changing. But if such opportunities comes, I mean, you are part of this network, Romana, so we'll keep you posted. And please check in as well on to ensure we can continue to support. But right now, it's because it's our last year, we're not in a position to be funding any Kenyan SLI. But what we can continue to do, it's help you with some of the tools you might need to raise awareness. So let's have a separate conversation. Maybe if you email the CAM team separately, and we can think about how we can continue to support you. Yeah, perfect.
Yeah. Thank you so much, Leila. And I forgot to introduce my name. I'm Rumana Isaac. I am the
I know Rumana.
I am the national coordinator for Survivor Network. Thank you.
Nice to see you, Romana.
Thank
Okay,
you.
one more question from Jacob. One more comment from Jacob.
So there's a comment here that I feel I should read. And it reads, "You are doing a really great job, in my own opinion. I think even people that are not survivors should be more empowered, because some of us come from communities that people hardly speak about this vice, and hence, if not empowered about the same, we can hardly have this candid conversation with people that we know are survivors and can come on board and join hands to fight in the fight of FGM. Kindly empower us more on the grassroots level."
Perfect. Thank you
Great.
so much.
So with that, I think we are happy to move to the audience. And for the audience, I have one question for you. After having this conversation and interacting with the panelists and reflecting together, how has your perception of FGM changed after this discussion? Please put on the chat box, and me and the team will look at that. So we have just a few minutes. Just utilize the chat box and share with us how your perception has changed after this discussion. And I'll be reading some of those comments.
Just wanted to clarify, that's separate from the poll that we're doing afterwards, right?
Yes. So just taking about just a few minutes to have this reflection.
Just wanted to check.
And then, yes. And Marcus also posted the question on the chat box. So just take a few minutes and share with us your reflection. How has your perception of FGM changed after this discussion? As we wait for the audience to reflect, there's one more interesting comment here that I would like to read. I would like to commend you on the excellent presentation about FGMC. The content was very well prepared and impactful. So this one goes to all the panelists as well. Moreover, the presence of young doctors greatly strengthened the program's credibility. Looking ahead, if it's possible, for involved Ethiopian boys and girls as well as young doctors in future sessions. I believe their presentation, contribution, and sharing of experiences will further enhance the program's effectiveness and community engagement. Thank you for your valuable work. So this gratitude goes to everyone who has spoken today. Any reflection on the chat box?
I
I'm
think
not seeing any.
Jacob, no, because
Yes.
people might want to share this privately. So I would say let's go
Okay.
straight to the poll. Yeah,
All
so
right.
people can just, yeah.
Great. Then Mark will share a poll with us. And it read, do you think reframing the narrative is critical in efforts towards ending FGM? Do you think reframing the narrative is critical in effort towards ending FGM? Say yes. Just press the button yes or no, and then Mark will share with us the poll. See yes or
Jacob, you went silent, just to let you know.
I'm hoping that we've had a
yeah.
chance to drop in our thoughts there. Mark, do you want to show us the result as I invite Leila to reflect on that? Over to you, Leila.
Thank you. Actually, I would like to ask, I don't know how this works with the technology and how quickly we can do. Maybe Mark and Anne, is it possible to repeat the first question on the poll? Is that possible to do that?
The first question on the poll?
Yes, the first one, the one we asked right at the beginning. The one we asked right at the beginning.
Okay.
Yeah. I want to know what people respond to that now. What would that question, how would they respond to that question?
Okay. He's relaunching.
Perfect. Okay, forget about the historical part, but how would you now define FGM? Culture, crime, rites of passage, harmful cultural practice, violation of human rights, child abuse, this is after you heard our conversation today. Perfect, thank you. Great. Let me know when that's finished. And please share the results with us. Thanks.
All right, thank you. Yeah, so for this one, 6% of those who have responded say they would call it culture. 31% who have responded would call it a crime.
We can't see it on the screen, Anne, sorry. Can we see it on the screen? Or we can't see it on the screen in case you think you're sharing.
Do I share?
Yeah, perfect.
Can you see now?
Okay, it disappeared. It was there.
Okay.
Okay, yeah. Oh,
okay.
It keeps disappearing. It's fine. You can.
I'll need to, okay, my hand here. So 6% say culture, 31% say crime, 0 have said rite of passage, 56% have said it's a harmful cultural practice, 88% said it's a violation of human rights, 69% have said child abuse, and another 69 a form of gender-based violence.
Yeah, perfect. Thank you for sharing that. And there was another question you asked.
Yes, so the other question that we asked was about reframing. Do you think that after this conversation we need to reframe? And we already got that answer. Majority said yes. Do you want to post that again, Mark? Relaunch it. Okay, Mark is trying to do that, but in the meantime, from the comments,
Okay, so if oh, you got it. Perfect. Thank you.
so the answer here is 92% yes, we need to reframe. 8% say no, we don't need to reframe. So
Great.
that's
Yeah.
that
I mean,
we will.
clearly from
Oh.
those results, you can see there needs to, a shift is happening even from this conversation, right? And our aim is to really continue to stay with that message over and over again. Like keep remembering that we are dealing with violence against women and girls. Maybe one more comment from the chat, and then we'll do the closing remarks.
Yeah, I'm happy to read a comment. So this webinar has reinforced, I disappeared. This webinar has reinforced what SLI made me realize on the importance of language. I now feel that if it was possible with presence of funding, I would really want my community to get awareness on the language, that they should know that it's a violation of women's rights and child's abuse.
Thank you so much, Jacob. Maybe do you want to read another one?
Yes.
Have space for one more.
There's one from
read one more.
Florence. The fact that we should be concerned about the language we use to refer to some of the terms we use in reference to FGM is of great help, because we will definitely have a more greater conversation with survivors and non-survivors. Hence, this will definitely be everyone's affair, or rather responsibility, to protect our girls and women. Thank you so much. Indeed, it has been a great learning.
Perfect. Thank you so much. And I think we need to always consider this. This is a beginning, again, of a conversation that we will continue to have. Our aim today really was to open up the space, for us to just really ensure, in order to protect survivors of this very brutal violence, why language is so critical, that, because it could be very harmful. So I would like to welcome Alice, who's our lead for the movement building, and Alice leads on our SLI work. And can I say, through this work, one of the great things that happened is one of the SLI members is now training to be a therapist. Alice is also training to be a therapist. So I love that through the work of TGG, we are recognizing we need more healing spaces. So I also would like to welcome Alice, who's also a therapist in this team, to do the closing remarks. Thank you.
Thank you so much, Leila. And I must say that I feel so privileged to be part of this conversation. Allow me to start by appreciating our incredible panelists, every participant who joined us today, our interpreters and moderators. You have all made this conversation really quite very great, and we appreciate you all. I want to echo Leila's remark. This is a conversation that we are very passionate about as a program, and we are hoping that we can continue having it in different places. To our speakers today, your insights, the realities and the bold truths are deeply moving. And it is interesting that for me, every time I am in this conversation, it brings new insights all the time, and I really appreciate it. You have reminded us that ending FGM, as well as, of course, other GBV, are not just about programs, but they're about policies, they're about people, they're about power and purpose. Most importantly, I want to really honor and appreciate the survivors. Every survivor of this violence who continues to courageously step forward, not just to share their story, but to lead the charge to end FGM. Rest assured that your leadership is valued, appreciated. And you are reshaping the movement with authenticity, resilience, and vision. We thank you so much. We stand with you and we follow your lead as we have been doing. Today's conversation is crystal clear, and we have had it, all of us. Language matters a lot. The words we choose are very important, and they can either entrench violence or dismantle it. So we need to be very careful, because words can stigmatize or empower. And for far too long now, language has been used to excuse harm. As we have just heard, it has been used to erase survivors' voices. It has been used to normalize FGM as a tradition, which today, if we didn't know before, we have now learned that. But we know now, and we must commit fully to reframing it, to reframe the language and to speak truthfully, to center empathy and justice, and to name FGM for what it is. And this is where I want you to underline now. This is where I want you to put it in bold, to italicize it, or even just highlight it in a color that is most visible to you. That FGM is violence against girls and women. It is not a culture. Now, this reframing work must be survivor-led, just like any other work on ending FGM. And you may ask why? Why should it be survivor-led? There are so many reasons, and we have heard some of our speakers alluding to those reasons. But let me highlight one key reason. Survivors must lead because those who have lived the pain are the ones who best understand what healing looks like and what change truly requires. And this has been very well demonstrated by our speakers again, that the movement gains truth, integrity, and unstoppable power when survivors lead. So, survivors must lead this charge. And with the discussions we've had today, let us leave this webinar with a commitment to be intentional with the words we use, to listen deeply to survivors, and to continue building a movement where language becomes a tool for healing and not for harming. And now, as we wind up, let me catch our attention again to some of the documents that we have developed that speak to the conversations we are having here. And Viola will be sharing them in the chat box if she hasn't. I would please urge you to interact with them, and also to feel free to reach out to us in case of need for further follow-up. Yeah, and the documents that we'll be sharing today include our Power of Language position paper, and there's someone who requested whether we have anything that can guide this conversation. That's a very good tool that you can engage with. We also have guidelines on engaging with survivors of FGM, another powerful tool. And we also have a booklet of stories of change. Viola, if you haven't shared any of those, please do so now so that our audience can interact with them. Again, my appreciation to you all for your presence, your passion, and your solidarity. I urge us all to keep pushing, and for sure, we shall win. Thank you so much, everyone, for being with us today. And I'll hand it over back to Leila. Thank you so much.
Thank you so much, Alice, for really bringing us to such amazing close. I mean, just to say a massive thank you to the amazing audience who showed up today. And I know many of you show up to all our series of webinars. Like I said, this is part of how we support the movement. I mean, the panelists, without you, this conversation really couldn't have happened. So thank you so much for continuing to engage in this space. You know, as we say in our position paper, words matter. They can either harm or they can heal. So it's really important. So together we are learning how to choose language that leads to justice, inclusion, and healing. So thank you all so much. Please take good care of yourself. This conversation is extremely triggering. We are talking about violence, so please do something very lovely and kind for yourself after this call. Yeah, please take care of yourself, and we'll see you at our next webinar. I'm going to give the last words to Anne and see if there's any other requests that she might have before you log out. Thank you so much.
Well, Leila, no other requests, just to say thank you very much and to echo your words that we've had a very good interaction and let's keep this going. If you have any questions, feel free to reach out to the Girl Generation team and we'll see how best to support and collaborate. Thank you.
Perfect.